South African Healthcare by Sam Coles. The lack of access to healthcare for poor South African citizens is a large issue in South Africa. The South African healthcare system has undergone numerous changes over time. During the years of segregation and eventually apartheid, black South Africans were provided with very little state-run medical assistance as compared to white South Africans. Since the end of apartheid, the healthcare situation has improved in some facets but actually regressed in others. This brings to mind many different questions. What are the main reasons so many South Africans do not receive adequate healthcare? Is the healthcare system currently being employed even that large of an improvement over apartheid policies? How can the healthcare situation be improved upon? In order to better understand the current situation, it is best to get some historical context. In 1910, the Union of South Africa was formed, and the 4 different provinces were each put in charge of their own healthcare. In the mid-1940s, the Gluckman Commission tried to install a number of community health centers to serve the community's health needs, but the plan was eventually rejected when the Nationalist Party came into power and started apartheid. This event is pivotal because if the plan would have been implemented, it would have resulted in much more access to healthcare for all citizens. During apartheid, the healthcare system was further split up into different groups as each Bantustan had its own health department. Health services in the Bantustan were systematically underfunded. By 1986, public sector healthcare spending per head ranged from 23 Rand in Leboa to 200 Rand in Natal Province in the Cape Province. Black South Africans were receiving health care that was not up to standard and that was nowhere near what white South Africans were receiving. After apartheid was ended, all of the health departments of the Bantustans were consolidated into one national and 9 provincial health departments. A problem that continues today is that not all provinces receive the same amount of funding per person for public health care. As a result, richer provinces receive much better health care than the poorer provinces. A statistic that displays this point is that in 2000, mortality rates for children under 5 years ranged from 46 per 1,000 live births in the richer Western Cape Province to 116 per 1,000 live births in the much poorer KwaZulu-Natal Province. Until the 1970s, private sector healthcare was only offered to whites, and by the 1990s, the number of private hospitals was expanding, and 62% of general doctors and 66% of specialists were in private practice. By 2007, the number had risen to 79% of doctors working in the private sector. In recent times, according to the National Treasury's Fiscal Review for 2011, the GDP spent on health was split as follows. 128.8 billion Rand, which is 48.5%, was spent in the private sector, which covers only 16.2% of the population, and many of these people already have medical insurance. 122.4 billion Rand which is 49.2%, was spent in the public sector, which is made up of 84% of the population, who generally have to rely on public health care. With 84% of the population having to rely on public health sector for health care, having only 21% of the total doctors working in that sector is very inefficient. Essentially, half the money spent on healthcare provides for over 80% of the population, which is significantly off proportionally. The quality of care provided in the private sector almost always exceeds the quality of that provided by the public sector. In a survey done about the accessibility of healthcare to citizens of South Africa, a significant number of citizens said that they would rather use health services from the private sector, even though it would result in catastrophic payments. Several other reasons are to blame for poor South Africans receiving much worse health care, including that the poor South Africans oftentimes struggle to even get transportation to medical facilities, or they cannot even afford it. They cannot afford treatment, or they do not believe they are sick enough to be treated, or they feel as if they were to go get treatment that they would not be treated respectfully. In 1994, after the end of apartheid, 8.5% of the GDP was spent on health care, which is actually a large amount, but over 80% of the spending went towards hospitals, with only 11% of spending going towards non-hospital primary care services. The issue with this is that generally only richer citizens can afford to go to hospitals, while the poorest South Africans tend to go to primary health centers where they do not receive care that is of the highest quality. In present-day South Africa, primary health care has risen to 21.1% of healthcare spending, but that is still not proportional to the number of South Africans who have to utilize primary health care. Obviously, having wealth allows one to purchase better health care. Since 1994, the Gini coefficient, which measures income inequality, has actually gone up, registering a number somewhere in the range of 0.7 to 0.8 for South Africa, which shows that South African citizens are becoming less equal when it comes to wealth distribution, with the rich becoming richer and the poor becoming poor. With the poor becoming poor, healthcare is even more difficult for them to afford. There have been numerous other complaints about how the new government has dealt with healthcare. For instance, the government shut down many nursing colleges and as a result now has a major shortage of nurses. Also in the healthcare sector, to reward those who were loyal to them during apartheid, the ANC gave manager positions to people who were unqualified and inexperienced, and the ANC refused to hold the new managers accountable when they made mistakes. The government during the late 1990s to mid-2000s was severely criticized for not spending enough money on the treatment of HIV/AIDS and for thus allowing the disease to spread. Recently, the government has stepped up efforts to try to improve the healthcare system. Within the past few years, the government has started implementing a program named National Health Insurance, which eventually aims to provide universal health coverage. This would help to alleviate the issue of the poor having to pay very high out-of-pocket rates and additionally allow them to receive better health care. The government has also increased its expenditure on the treatment of HIV/AIDS from 6.3 billion rand in 2010 to 10.9 billion rand in 2013. Though healthcare in South Africa is improving, it could still be made better with more changes. One of the best changes that could be implemented would be to find a way to redistribute income so poor South Africans would no longer be so poor and could better afford to pay for their health care. One possible way to implement this plan would be to install a progressive tax. The South African government should also fund more education programs which could educate citizens about how to prevent the spread of diseases like HIV/AIDS. Also, the South African government needs to find a way to train more nurses and ensure that they work in the public sector, as there are few new nurses entering the workforce currently. The South African healthcare system after apartheid ended was a disaster. As time has gone on, it has improved slightly. Hopefully, with the universal healthcare system currently being implemented, all South Africans will eventually be able to gain access to good healthcare.